Alright, here we go. What is the most important thing you'd like healthcare professionals to understand about pain?
Listen to the individual who's got it.
Yeah, listen. That would be, that's my experience. Because I want people. Pain is so hard for you to understand, let alone, So when you're trying to explain it, and it's so real, and the impact is so huge, that and as you said earlier about, I felt guilty. I felt guilty for having this pain. It's impacting on my partner's life, on my family's life. And so you're carrying that. You feel that guilt and you feel like you're a burden. So you want the health professionals to really hear what you're saying and not to come out with, sort of well-used sort of hospital speak or cliches like, which just, and felt that they were presuming before they'd heard your
side of the story.
Yeah.
For me, it's education.
Yeah, and I totally agree.
I have to say, for me, it's education, because when you're first injured and you're first to have your problems and your pain is, as we had said before, this catastrophic thing, they're quick to deal with that. The healthcare people are quick to deal with that, and they're great at that part of it. But I think it's at the latter stages that they need to give you more. They need to be more education with the long term of your pain, and that will then help you manage your pain.
Well, I think listening comes into that, because if you really sort of have good education and development of staff, and a lot of these pain clinics are nurse and therapist led, and some of them are excellent, but it's my experience is that the people that are working in these teams are not, they haven't had dedicated training, and they really need to have specialist training if they're going to support us.
It's like they don't believe you sometimes, isn't it? If you say your pain is 8 out of 10 and they say, really?
Yeah.
And it's like, well, yeah, it is 8 out of 10, otherwise I wouldn't have said 8.
Out of 10.
And I hated being questioned.
What 8 out of 10 is. Are they really trying to imagine what 8 out of 10 does to you?
But then doesn't it also boil down to the fact that they are not in that it's easy for them to say what level of pain you're in, but it's really hard they can't fathom because they've not had that pain.
But education will teach them and train them that actually, when we're talking, to be honest, I think these numbers, I hate the numbers, but it's actually what the impact of 8 out of 10 is on your life. So if you're coming into a clinic with a pain out of 10, 8 out of 10, how did you get there? How did you manage the journey? How did you manage, how are you managing to sit in the waiting room? How are you managing then to sort of, explain your pain? What you're going to do when you get home? Who's going to cook your supper or do your shopping?
Exactly.
Those sorts of things.
And if you kept waiting for an hour in the waiting room, how do you manage the sitting there for an hour in the waiting room, not knowing actually how long
you're going to still be there,
and then how do you cope with the rest of your day?
They need to. I think in everything people do tend to say, "Well, I know how you feel," but I think for a healthcare professional, they say that, but they don't know that.
No,
and I think that's a big thing.
You probably wouldn't wish how you feel on
anybody, but then to try and explain to them how you feel. That's the hard part, and that's the part they need to know about. To take seriously, they need to know that, and like all their training is through. I suppose it's one of those you ask. Again, what you say, listen.
Well, I think it's engaging. I had a very a bad experience when I was in a consultation with a pain consultant and the specialist nurse, and there was also a therapist there, and the specialist nurse was the person who was my point of contact. So I'd had contact with her before in terms of follow up and appointments, etc. And during the consultation, she was texting.
Oh, come on.
No, that's wrong.
I was I was devastated, and I said, look, how can you possibly? I want you to be engaging with me. I want you to hear my story. You can't. What's your purpose?
See, that's the thing with pain, and it's also the thing with telling people about it. Is again, unless they've experienced a level of pain that you are in, as I said before, most people have a level of pain that they live through, but that it's not, like you said, a headache. What's the worst pain? I've had a headache. So, but the level of pain that we live in. But then to sit down with somebody and go, well, this is the level I'm at, and you've never experienced that, it's very difficult for them to comprehend. But with your one, what she was probably doing is the repetition of hearing, what level are you at? I'm at 4, well, I'm 5, right then. And she's probably, because she's been in that for so long, she's blinkered to your
part of it, that you either get people who are a bit blinkered, or you get people that are sort of slightly
desensitised.
Or desensitised, that's right, or people that maybe haven't had sufficient training. There's lots of areas of excellence, but unfortunately, I think, again, probably, we know where we are with the health service, resources are thin on the ground, and actually supporting people with pain is resource heavy. It isn't something that you can just put a person in a clinic for 30 people. You've got to have
one-to-one
individual.
You've got to have and continuity.
Because we're all individual. Our pains are all at different points in different places. So having that one-to-one with somebody and having that person explain to you to what level that pain is and how it does affect your life, because it does affect your life. There's things that you can and can't do with it. But having that recognition from the other person, from the consultant, from the doctor, from the nurse, then with the positive nod saying, oh, well, yeah, I can see where you're coming from. I can see where you're coming from.
It's probably more about feeling that they feel compassionate about your pain.
What you're going through.
Yeah, and I think that can be missing sometimes.
If you've never tasted chocolate and you tell somebody that chocolate's fantastic, how are they going to know that chocolate's fantastic unless they've tasted it? Exactly. It's the same sort of thing with pain, if you get my meaning.
But I think also at a time of poor resources, I think healthcare professionals need to be signposting us more out into, even if they can't provide, the service. What would be helpful, because that's what we don't know, and so relaxation strategies, whether or not mindfulness, certain therapeutic approaches, what might be useful, what we might want to look at, where these services could be.
I think as well we should be encouraged a lot more to take responsibility for ourselves. I think that the healthcare service is overworked, and signposting would definitely enable us to take control of the things that we want to access.
But that's the education bit for later on that I think you should have. You're given great help at the beginning, but you're not educated further on down the line of what's available, what facilities are out there for you. So I think later on in your conditions that you need to, because at the beginning you're thinking, I've got this pain, right, medication is dealing with it, but do I really want to be on it for this amount of time, for years and years and years and years and years? So what now can I do 1 year, 2 year, 3 years on, 4 years that I can do now to not only reduce my medication intake but to manage the pain? And that's where the education then needs to come in. Somebody needs to come up to you and go, right, you've now been in this for 2 years, 1 year, 3 years, 4 years. How are you feeling? How is your pain level? Blah 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 blah. Right, have you ever thought of doing this, or have you ever thought of it doing this way? You don't get that. You know what I mean? It's down to you to do it yourself, and you've got no one there to do it.
My memory of my rehabilitation in Stoke Mandeville was that, we did have these education sessions, but I think pain was very low down on the agenda.
Very low down.
We talked about, bowels and bladder and sexual functions, and, exercise and diet. But actually pain, it was really low priority. And then I don't remember getting, I think I got a couple of handouts. But that, it didn't feel to me as though it was being fully taken on board.
And it's the one thing that everybody at some stage in different ways goes through is pain. At one level or another, you're going to have that.
So how do you pace yourself on a daily or weekly basis? For instance, how often do you take rests during the day as well as taking whole days to rest?
Most of the time, everything I do, I have to plan.
Yeah.
Because of pain, and also with the fatigue, and also the aftermath of doing something for one day. So if I know I've got a busy activity day, going out and doing things, I do know that by the next day I am going to be in severe pain.
Yeah.
So then that day is not so active. I don't do so much. But also if I go to a familiar place, I always make sure that I've got somewhere to sit down. I walk my dog. I take my dog to the park. But I go to one specific park because it's got benches around the park, so I know I can go from bench to bench to bench to bench. I still can walk around the park, but I can sit down there. Get into the park, I also know that there are people's walls that I can sit on. So then it's re-planned in my head, so that I know I can get from A to B, but I need to sit down and rest. But I can still do it.
So what would happen if you went to another familiar place? How would that work?
That is difficult, and in doing that, I tend to, if it's a place where I'm going to have to do a lot of walking, what I do is beforehand, I put things in place to compromise. I have brace for my knees, I have my walking stick, I have things like that with me, so that if it's going to be a long way, and also I have my partner with me. If it's going to be that way inclined, I then have my partner with me. So I put things in place to help or negate, so that I can still carry on doing those things. I still can walk my dog around the park. I just sit down a little bit more than most people, and that's what I do to help with the pain management.
But I mean, so what you're describing is sort of what we've been talking about. Really, is actually you're in control, but and it's about planning and creating an environment that is safe and gives you a structure, and you're having a good time. Walking your dog is important to you. You're doing something you enjoy.
Part of exercise as well, as we've said
part
before.
Of exercise.
And getting out.
And I mean, what you say sounds very familiar. It's a sort of, I will pace myself. I hate the word pace myself. I remember it. They used to say it to me
all the
early
time.
on. You've got to pace yourself, and I just can't. I hate it. And I met somebody recently on a backup course who also hated it, and she says that in her house they call it the P word because they can't bear it because I think it's the way it's being used in a way of sort of, if somebody says to you, you've got to pace yourself, and you're not ready to learn how to pace yourself. You don't want to be told that. So I like to think that I'm sort of structuring my day.
That's a good structure of the day. Is a good way to put it.
So I will take it. If I don't take a rest in the early afternoon and keep going, I'll pay for it in the evening, and then by then I've got to a stage where I can't move.
What do you do in the interim? So if you've had a busy day, what do you do to relax? What is your relaxation so that you can get through the rest of the evening? And what are the dangers if you don't?
Well, I lie down and stretch out, and I really do stretch my legs. And as I said earlier, I listen to radio dramas and books and things like that.
And that relaxes you and everything.
Yeah, it helps me rest. If I don't do that, it means I'm staying in my chair for doing things, whatever it is. I've got stuff going on, and I'm just pushing myself to. I don't want to give up. Basically, I don't want to sort of say, I want to finish what I'm doing. So it's my own fault, and I know I'm doing it. It happens less and less. But it does happen, and if it does happen, then I get to the stage where everything has got so tight and painful. I might go up 6 o'clock. I'll have to go and lie down, and I might not come back downstairs. Whereas if I rested, I could do something in the evening, and with people I want to see. So
totally.
It doesn't happen so often, but I'm not quite as good as you, and I don't think I've quite got to that stage of getting it right. I mean, we're allowed to make mistakes, aren't we?
Most of what I try to do, like yours, is I try to get out, which is why I have to plan what I'm doing out. away from home, because it's a safe thing for me as well. So that's the reason why I can sit on people's walls. I do check the park out beforehand, that I could sit in the bench and walk around on each bench.
And you see other people as well.
Totally,
It's great.
fantastic.
So it's a social
Absolutely
time as
brilliant.
well.
I loved it. I love walking my dog. I love talking to people. It's, I suppose in some ways I see the grass a bit greener, I see the sky a bit bluer at night, and the sun is a bit brighter. So that's what I do. So gets me out. Right, let's go for this one. It's a long one. Right, with pain, it is sometimes hard for people to understand as it's not visible. Yeah, spoken about that. What kind of attributes or attitudes have you encountered towards your pain, and how do you deal with them?
What kind of attitudes? I mean, I don't think I've ever sort of encountered anything that's negative. I mean, as we've talked before, it's sometimes hard to get people to understand what the impact is. I think a lot of lay people who've not had experience of pain will think of it as an acute episode that you either have to sort of take a day off work or you take some painkillers and slow down a bit, and then it's all sorted the next day. So I think a lot of us, unless we've had experience of living with somebody or ourselves with chronic pain, as we've said, it's difficult for them to understand. But I don't think people are interested and they want to know, well, what do you do? How do you manage it? But I don't want to
keep on about it.
Talk about it. Also, it all sounds, at some level, it all sounds a bit
boring,
woolly and pathetic.
Yeah, but
because
but it's part of your life. It's part of you. I know, and it's unfortunately it is that part that you're going to have, and it's the hardest part to explain to people. And you don't get people that are negative towards it in respect. They don't go, oh yeah, well. It's one of those things that it's hard to explain, and it's not about the immediate pain, it's the long-term effect that pain has. And with most people, like we've said before, if they've got a bruise on their arm, you see the bruise on their arm or leg and you go, oh, that was painful, because you're visually seeing that pain. You can see that pain. Again, with a cut, you can see a cut, you go, oh, that looks bad. Or somebody's wearing a plaster cast, you assume that they broke their arm or broke their leg, and you assume that must have been painful. But you with us, it's more, for me, it's more inner pain. It's the pain that's there that you can't see, and that's the hard part of explaining to somebody.
The emotional
it's
pain.
the emotional pain and the background pain that you've got that they don't see, because it isn't a visual thing. It's not a visual thing. You can't see it and you can't point at it. And because it's inside, it's still there. And again, as people say, because it's weird when you tell people, we've said this before, you have no feeling, but you can still feel inner pain, and that's hard to explain to somebody that you have. By the way, I've got no feel. I can't feel nothing on my right side of my body, and then they say, oh, I've got a bit of pain here, and they look at you weird. Why have you got a pain in the part of your body where you have no feeling? And that's hard to explain. I think that part of it.
I think it's interesting what you say about the emotional pain, and I think there is a lot of emotional pain, and there's no doubt about it. And I think, in a way, that was one of the hardest bits. To an extent, I feel that I've really worked hard with. I had some, help with a therapist in this sort of cognitive-based therapy. I worked really, really hard to accept it, and I think that really taking it on board, saying, "Look, come on, pain, you're with me, you're part of my life," has really helped. So I don't feel the same. I don't feel that. Occasionally I will feel it, but I don't feel it to the same extent. And when the pain, in the early stages, when your pain is invisible, and you wanted people to understand, I sort of found the invisibility quite frustrating. But now, in a way, the invisibility is good, because it means that you can
get on. Sometimes you do want that neon light saying, I'm in pain, I'm hurting, this hurts me, and you want everybody to be able to see it and everybody to go, can we help you? Oh, what's wrong? And things like that, because you want them to see that, because there is no visible side of it. But then as time wears on and you're more adapting to it, you want that sign needs to go away, because now that is not the be all and end all of who you are. That sign needs to disappear. To be seen as a person. But as a person without that big sign, because you think, well, this is it. This is how So,
What difficulties have you encountered with getting appropriate support for your pain from healthcare professionals?
I think we've gone through that in the way that in the early stages they do flood you with medication, and then afterwards you're kind of left on your own to your own devices and your own decision on, can I take a certain, shall I reduce my medication? And you do it yourself. You know, I've constantly gone, when I go to the doctors, I constantly say, can I reduce my medication intake? And the first thing is, they look at the medication, they go, no. But mentally I'm thinking, well, no, I want to reduce what I'm taking. So you do take, you miss out one pill, see how you go, and if it does affect you, you go back to it. But if it doesn't, you think, well, I can live without that now. So that's what I've been doing. For me, is I've personally been reducing my medication, judging how it's affected me, and if I haven't felt any change, I've now taken that medication out of the system. And I think that's what I do for myself, and I think a lot of people who have had long-term pain and who have long-term, I think you come to a decision where you sit back and you go, I don't want to be taking 20 pills a day. Let's see what happens if I take 19. And if nothing changes, then you think, well, let's see what I can take if I take 80. And then you work your way down to, like everybody says, a comfortable position where you've reduced your medication to a level where you're happy. But when it comes to pain, I think we all have a backup. And it starts with, take a paracetamol. So they say to you, have a paracetamol, and you say, well, paracetamol's not good enough, I need something stronger. So you go one level more, and then you go one level more, because we've all been on the high. And we don't want to go back to that high level of medication. So what we do is we start off at, now we've gone the opposite way. Now that we're in long-term pain, we've had this pain for a while, we don't want to hit the big and the strong stuff. We want to start off at as low as we can, because the be-all and end-all is not to take any. So now we come in at the lower level. But I think everybody that has long-term pain, I think they have that safety net. Of a painkiller, whatever level that painkiller may be. I think everybody has that safety net, that one pill that they know they can take. That will help.
And and we take responsibility for doing that without using a healthcare professional. I mean, I think to a large, I agree with you, because the healthcare professionals, certainly when we're a number of years down the line, we know what helps us much more than they do. However much pharmaceutical knowledge they've got, it's actually what the impact is on the individual. But I think, the good healthcare professionals have been the ones that have seen the much more holistic sort of approach and sort of thought about, what the other therapeutic supports approaches can offer. And I think one of the things that I've found helpful in parts was sort of this, well, first of all, this acceptance commitment therapy, which was fantastic, but that led into a sort of mindfulness acceptance course that I went on, and I was a bit suspicious about it, because it was all these things that sort of sound, a bit off the wall, and what do they mean? But it was really good for me, because it made I did sort of get into really good relaxation, and sort of I got into this sort of breathing, which really helped me relax. And we did this what's called this body scan. So you're just just lying down, and you're just shut your eyes, and you've got slow, regular breathing, and you're just going from your head, feeling your body all the way down. And it was great to begin. No, actually, to say a lie, we started at the bottom. We started with our feet. So, of course, I couldn't feel my feet, but I really focused on them. And then we came up the leg, and and of course I couldn't feel that. We went all around the perineum, and you bottom. I couldn't feel any of that, but I got right inside that part of my body that I'd sort of lost touch with, and I found I did, and that's the bit that is painful, because I'm painful right below the level of the injury. I'm T10, and so when I got to the top, I still kept the focus and the concentration, but the benefit has been, and I still do it now. So I close my eyes and I really do that body scan.
But then it's engaging with the parts of your body that you can't feel.
No, because it is engaging with those bits, but it's helping you to feel them and keep in touch with your body.
Because you forget about them.
You do forget.
Because you can't feel them, you forget about them, but they're there.
Yeah, exactly. And then and I just found that really, really helpful, because even though those are the painful bits, I suppose maybe you're just releasing some of the tension around those painful bits, because we know that stress and tiredness and tension often makes the pain worse.
Yes.
And obviously I can't lie down all day, doing that. But as an exercise, I did find it really helpful.
But can you do that at any time? So it's like when you're sat down, can you just suddenly go into yourself and just go through that feeling, or do you have to be in a...
No, I tend to sort of... You're right. For me, when I'm resting, I do it. So if I'm lying down and stretching, that's when I do it. I mean, I don't do it all the time. I might do it sort of like 2 or 3 times a month. And really, they encourage you to do it sort of 6 times a week. But I don't do that, because it's a time thing,
Yes.
But I'm glad somebody, because I'm not the sort of person that would immediately go to those sort of therapeutic sort of areas.
But you never needed to before.
No, that's true.
And that's probably why you didn't go.
Yeah, but I have found it helpful.
And I think that at the end of the day, whatever you do, I mean, when you're first in your injury or anything, pain-wise or any-wise, is that you take everything, you want whatever they give you.
Yeah,
I always say in life, if anybody's giving you anything, take it and get rid of what you don't want.
Exactly,
and then that goes through with everything. You take everything they give you, and then because you always say, I'll never go to that, that's got nothing to do with me.
Yeah.
You never know.
You never know,
exactly.
And it's a real eye-opener sometimes.
Some things are, I totally agree. So our next question will be, what activity would you give to someone newly injured to help them deal with their pain?
All right. Well,
what activity would you give them to do?
Newly injured. Well, I guess newly injured. Well, I mean, it's just it just depends. Really, I mean, we've talked about distraction activities, haven't we? But if they were in a huge amount of pain, I think from what I just said about the mindfulness, being in touch with your body, massage is a great one, and you can, somebody can come along and give you a massage, but actually I frequently will just massage my legs and my feet.
Again.
And it's engaging with your body, it's getting the circulation going, and it's a distraction as well. But so
I think personally, it's a big thing. It depends on the level of their injury. It depends where their injury is and how that injury is, but then where that pain is. Because you can only give certain advice or certain relaxations if it affects different parts of the body and how that then affects you. So it's a difficult one to say what exercise should you or what should you do. But as everything, do everything. And I think the best thing is to do everything and then do what suits you.
So you could, maybe we would talk to them about the different things that have helped us over the years or the different stages, and let them sort of get a feel of what might be right for them.
It's like trying the dishes. You don't know which one you like, so you try a little bit of each one. And it's also giving them the idea. Most people will blinkered and live that there are only 3 things in that dish, that they would do. What we can do is give them 10. So instead of trying 3, they're now trying 10. And it's ideas that, I never thought of that. So that's another thing I think.
I think that's really, really helpful, because when you're first in pain, you feel helpless. And, physically you feel helpless. And you've got a spinal cord injury, which is affected a huge part of your body, which won't do anything anymore. And your brain is, sometimes it's just blinkered out with drugs. So you can't think beyond anything.
Exactly.
So I think sort of understanding what different approaches might help at different stages gives them that choice.
Totally.
Yeah.
And I think that is what it comes down to is with an individual who has had an injury, the more choice you can give them, it just means for them it enables them to decide. They've got a bigger picture of how they're going to manage and deal with their pain. Whereas if you give them 1 or 2, they might need 10, they might need 20. And I think talking to people and hearing about other people and things and trying everything. I at my stage I will try anything if it helps. If it doesn't help, then I can say I've tried it and let it go. But that's how I think people should do it who are newly into an injury. Try everything because you don't know what's going to help and what's going to benefit you.
Maybe we'll be able to say, look at the backup videos.
That would be good.
For the next activity.
Watch those, yeah. And the last one. What potential doors have been opened by your experience of pain, e.g. helping others?
Helping others, well, I would say backup.
Yes,
You mean what the experience of pain in me helping others? Is that what the question's asking?
Yeah. So it's what you're doing here today. It's what you've been doing with mentoring.
Right. Yeah.
It's giving your experience to others and relaying what you've been through.
Well, I think if I hadn't have come into contact with backup, my life would have been completely different. And there's been obviously massive benefits. Not just in meeting other people who've got, spinal cord injuries and sharing, problem solving and having fun together, making friends, etc. But as we've said, it feels like volunteering for them gives you some sort of purpose.
Yes.
And certainly with the mentoring, I've discussed pain management with different mentees, and I think it's always sometimes they want to ask me what's worked for you, and I'm always very careful to stand back and say, well, what everybody's pain is different.
Totally.
And so what has worked for me isn't necessarily going to work for you. And so
But do you still tell them it, because you never know, they might try it?
Oh yes, I tell them, but I don't. I think when I didn't contact backup for quite a long time because I couldn't bear to speak to somebody who was already in pain.
I just
felt I couldn't bear it.
Yes.
And so when I'm mentoring somebody who's in pain and they're wanting, they want to hear that there's hope, that it's going to get better, and that it's going to go away. A lot of them do, and that's exactly what I wanted. So I have to be very careful how I talk about what's worked for me, but I don't want it to, because really it's ongoing work. It's ongoing work. So you've got to be careful that you put it very much in a manageable form and in those early stages, so that it doesn't feel to them that pain is a huge issue. Because if I'm being honest, pain has been a much bigger issue than the paralysis.
I can understand that totally.
If I had a choice, if somebody said to me, you've got 24 hours, you could have 24 hours living pain-free or 24 hours out of a wheelchair, I would absolutely, without a hesitation, go for 24 hours pain-free.
Wow, that's a big statement to make, Martha. That is very big to say. For me, I find what has this enabled me to do? Back up again. It's not, I think when we say back up, it's not just those words, it's what they give you. It opens your eyes to a lot of things. When you're newly injured, you don't realise that you believe you're the only one. This is me, because you are shut up, you are enclosed, and you tend to be self, and you forget. You do for a long time. You forget that there are other people out there, and there are people out there that can help you, because you are so closed in. You're dealing with with your demons. You know, you have your physical pain, but you have your mental pain, and you're dealing with those demons. So then, for me, when I got in touch with Backup, and for the first time speaking to people that have similar injuries but never the same, it sort of opened my eyes up, and it made me realise there are people out there.
Well, it gives you in a way, I mean, I wanted to meet, even though I was very well supported in my own community, I'd been at home for about 6 months, 9 months. I wanted to meet somebody else in a wheelchair.
Yeah, do you know,
I miss
totally.
them.
Yes,
you know?
because when in your normal life, you're not normally meeting other people. When I was a firefighter beforehand, so in my job, everybody was physically at a high level. So then when I had my injury, and then I'm now at this level, none of my friends were. I was not associated with anybody that was like this, you know. And it was only because my neighbour across the road, he had a stroke, and he had a walking stick, and he was paralysed left side. So and it was him that I mostly, because he was the only one I knew. And then Backup came into my life, and mentoring and everything that goes with it, and even doing this video, you know, I've learnt today different people have different pain, and different, and it's a huge topic, and it has opened my eyes. Having my injury in some way has made me not so self-absorbent, not so me. It has opened my eyes to the individuals and the different people that are out there, which I probably would never have encountered in my normal life in the way that I was before. I probably would never have encountered people as closely as I have who are in wheelchairs and who have disabilities, because my normal life didn't have that.
So do you think it's made you a different person?
Definitely. Because in my life previous to my injury, I didn't know anybody who was in a wheelchair. Not anybody. I know it's hard to say. I mean, people think why is that? But I didn't know anyone, because my life didn't revolve around anybody. My friends or anybody I knew, there was nobody in a wheelchair. Now,
you know,
totally, I've totally flipped the coin on my life before to where I am now, and what I've seen and the people that I talk to now and things like that. So having my injuries, it's like walking through one door, and that's how life is, and then suddenly I'm walking through a new door, and my whole concept of life, and I believed I had a good life before, and in my mind I did have a good life. My injury happened, maybe good or bad, it happened. But I've seen so much more to life and to people since my injury than I ever did. And I've learned more about myself through having my injury than I think I would have previous to it.
Yeah, well, I mean, I think, you know, I think from my experience, certainly meeting Backup, coming into contact with Backup, it has enabled me to sort of get back in touch with a real, you know, positive aspects of life and live life to the full. And in my role as a volunteer, whether it's, you know, mentoring or, as you say, you know, being here today, there is a part of me that wants to reach out and really share that, but also to, you know, to acknowledge that we're all different, and, you know, some people will want to live their lives in totally different ways. So it's just about sharing the possibilities and saying, you know, there is,
so much.
Try an activity course.
Totally.
You know, try, you know, read the Backup website. Just see that things are still there out for you, and that there's a really vibrant community.
There is pain. We're all going to have pain. If you have a spinal injury, at some stage you are going to go through some pain, maybe as weak as a headache, maybe as bad as hypersensitive hands, maybe it's the massive other end of it. You're going to have pain, you're going to have emotional pain, and you're going to have physical pain. And I think the whole concept of it is accept that it's there, it's going to happen, you're going to have it, but you can manage it. There are steps, there are organisations, there are people, and even in yourself, after a period of time, you manage the pain that you have. it be emotionally or it be physically, there is help, and you can do that, and there is light at the end of that tunnel when it comes to it. It's there, okay? It's part of who you are. It's part of your life, but it's not the be all and end all of your life. It's not the thing that makes you who you are. It's part of it, but it's not the whole of it.
I think in the early days, pain was associated for me with a sense of another loss. But now I've taken it on board. I feel that it doesn't stop me doing things.
It's there, but it's not going to stop you.
No, exactly.
Yeah,
that loss is in the distance.
Yes.
Yeah.
Yes, it's there, and it's not going to. Yeah, as you said before, it's going to hurt, but it's not going to kill you.
Yeah.
And that's
Pain,
that's the way I think.
Yeah. Well done.